to the 11th meeting of the House of Commons Standing Committee on Health. The committee is meeting today to study mental health aspects of the emergency situation facing Canadians in light of the second wave of the COVID-19 pandemic. For the first hour, we will have the Center for Addiction and Mental Health, Mr. Paul Kurdiak, clinician scientist. We'll have the Hubtown Brewing Company, Lisa Watts, founder and chief executive officer. We will have Mosaic, Salim Spendari, senior manager, refugees and migrant workers programs, and Ordre des Psychologues du Québec, Christine Grue, a president, Isabelle Marleau, director, quality and development of the practice. I'll leave this list of witnesses for the second hour for later. So I'd like to start the meeting by providing you with some information following the motion that was adopted in the House on Wednesday, September 23rd, 2020. The committee is now sitting in hybrid format, meaning that members can participate either in person or by video conference. All members, regardless of their method of participation, will be counted for the purpose of quorum. The committee's power to sit is, however, limited by the priority use of House resources, which is determined by the whips. All questions must be decided by a recorded vote unless the committee disposes of them with the unanimous consent or on division. And finally, the committee may deliberate in camera, providing that it takes into account the potential risks to confidentiality inherent to such deliberations with remote participants. The proceedings will be made available via the House of Commons website, and so you are aware the webcast will always show the person speaking rather than the entirety of the committee. To ensure an orderly meeting, I would like to outline a few rules to follow. For those participating virtually, members and witnesses may speak in the official language of their choice. Interpretation services are available for this meeting. You have the choice at the bottom of your screen of either Floor, English, or French. Before speaking, click on the microphone icon to activate your own mic. And when you're done speaking, please put your mic on mute to minimize any interference. I remind you that all comments by members and witnesses should be addressed through the chair. Should members need to request the floor outside of their designated time for questions or to intervene on a point of order raised by another member, they should activate their mic and state that they have a point of order. In the event that a debate is underway, and we do not debate points of order, by the way, members should use the raise hand function. This will signal to the chair your interest to speak and create a speakers list. In order to do so, you should click on the participants at the bottom of the screen, and when the list pops up, you will see next to your name that you can click raise hand. When speaking, please speak slowly and clearly. And unless there are exceptional circumstances, the use of headsets with a boom microphone is mandatory for everyone participating remotely. Should any technical challenges arise, please advise the chair. Please note that we may need to suspend a few minutes as we need to ensure that all members are able to participate fully. For those participating in person, proceed as you usually would when the whole committee is meeting in person in a committee room. Keep in mind the directives from the Board of Internal Economy regarding masking and health protocols. And should you wish to get my attention, signal me with a hand gesture or at an appropriate time, call out my name. Should you wish to raise a point of order, wait for the appropriate time and indicate to me clearly that you wish to raise a point of order. So with regard to speaking lists, the committee clerk and I will do the best we can to maintain a consolidated order of speaking for all members, whether they are participating virtually or in person. I want to thank the witnesses for appearing today. You'll have 7 minutes for your presentations. I'm going to try something new for this committee, at least for me, is when we get to the 1 minute time remaining, I will display a yellow card. That is yellow. I don't think it really shows up yellow. And when your time is up, I will display a red card. And please wrap up quickly after that. And I will do likewise for members as well for their questions. So we will go now. We will start with the Center for Addictions and Mental Health. Mr. Paul Kurdiak, clinician scientist. Please go ahead, sir. 7 minutes.
Thank you very much. And thank you very much for the opportunity to testify. And to start, there's no question about why there is concern about the mental health consequences of the pandemic for all sorts of reasons. But you have provided 5 questions or areas of interest. The first 2 The mental health impact of the pandemic on specific populations and gendered impacts reflect a desire to understand the mental health needs of the population, including specific groups. The second two areas, availability of support programs and the role of virtual care, are related to a need to understand accessibility of services. The final area covers the role of the federal government in meeting these needs. These are all important questions to consider. However, the main point I would like to make is that if we had properly functioning mental health systems, including properly integrated information management systems in each province and territory, this information would be readily available. The implications of not knowing population-based mental health or addiction needs or the services required to meet such needs is not limited to the COVID-19 pandemic. We have never known much about the mental health status of the Canadian population or the services that exist to meet such need. The availability of such information is required to monitor mental health system performance, and the absence of such information means that policymakers will not know how to adequately respond to need. So how have we determined population need in Canada? The main source of information has been generated by Statistics Canada surveys. While surveys have been incredibly useful in measuring the prevalence of the most common mental disorders, they measure mental health status at a point in time. A pandemic, however, is highly dynamic. In the void of timely, accurate information, small, low-quality surveys and polling firms have generated sensationalist results. My colleagues, Dr. Scott Patton and Senator Stan Kuchar, have commented on why these surveys are not a substitute for proper surveillance and why relying on them to respond to the mental health needs of Canadians is bad policy. Since 2015 in Ontario, the Ministry of Health has funded the ICES Mental Health and Addictions Program. We are a team of scientists, epidemiologists, and research analysts who work in close collaboration with policymakers. We use Ontario's health administrative data to map the performance of Ontario's mental health system. We have uncovered a lot of detail about access to care and the outcomes of certain populations prior to the pandemic. Some highlights. Between 2009 and 2017, the rate of mental health and addictions related emergency department visits nearly doubled in transitional aged youth. That's youth aged 16 to 24. Nearly half of those youth who had an emergency department visit for mental health and addictions related reasons had no prior outpatient access, meaning they were showing up to the emergency department, half of them, as their first point of contact. Only 2 out of 5 individuals who visited an emergency department for a suicide attempt saw a psychiatrist within 6 months following that attempt. All of these indicators can measure readily, and they indicate pre-pandemic that the system was not particularly responsive. We are also busy using the same data to understand the impact of the pandemic. For example, we will determine whether or not people who were accessing services prior to the pandemic continue to receive services with the massive shift to virtual delivery. We also want to understand whether there is more demand for services as the pandemic progresses, including addiction and suicide-related indicators. Prior to the establishment of the ICES Mental Health and Addictions Program, Ontarians knew very little about the performance of its mental health system. The same type of data we use in Ontario exists in each province and territory. With the small and coordinated investment, the capacity to measure the mental health system in each province and territory is feasible. Organizations like the Canadian Institute for Health Information, or CIHI, could have a federal coordinating role. There are also initiatives emerging, like the Health Data Research Network, that could also be leveraged for this kind of activity. Moreover, this same data can measure the impact of investments over time. The kind of work we do at ICES is useful for showing what is happening with the data we have available. It is not useful at measuring population-based need. For this, we need new infrastructure. Currently, the services for individuals with mental illness and addictions are the furthest thing from coordinated. In Ontario, we are planning on developing regional centralized access. Establishing centralized access will serve a number of functions. First, it will be one central place individuals can access for their mental health needs, instead of having to understand the various services in their niche patient populations. Second, over time, the characterization of the populations seeking care so that need can be measured dynamically. And third, once that need is understood, a determination of whether the services in a given region are capable of meeting need and an opportunity to realign services. This is exactly what has happened to support cancer, cardiac, stroke, and other services in provinces and territories. When I think about the questions posed by the Standing Committee, my main question is, why have we not built the infrastructure to be able to answer these questions with actual data? If we believe mental health is a priority, we need to commit to developing infrastructure that has resulted in developing world-class health systems in other areas of the healthcare sector, and to apply such knowledge and expertise to the mental health system. Historically, in the mental health sector, we have addressed problems by funding interventions and building programs and simply hoping they meet needs as designed. What we have not done is systematically measure population-based need for these interventions and programs. We have also not systematically measured whether the funded interventions achieved outcomes as intended. If we proceed with responding to mental health and addiction-related needs of the COVID-19 pandemic based on hypothetical needs and with no measurement framework in place, we run the risk of propagating an already fragmented response to the mental health needs of Canadians. Canadians with mental illnesses and addictions deserve a mental health system that is responsive to their measured needs and accountable for achieving certain outcomes. The only way this will happen is by developing system building infrastructure that has occurred in other areas of the healthcare sector. Avoiding this critical step will result in responses to need based on conjecture and advocacy with no capacity to measure the impact of such investment. Thank you.
Thank you, Doctor. We'll go now to the Hubtown Brewing Company. Ms. Lisa Watts, founder and chief executive officer. Please go ahead, Ms. Watts.
Thank you. My name is Lisa Watts, and I am the president and CEO and co-founder of Hubtown Brewing, a small microbrewery in the downtown of Okotoks. We opened our doors in September of 2019 after 4 long years of planning, writing and rewriting business plans, strategizing, fundraising, and growing our brand and building our community. I'd like to start by saying thank you for having me here today to speak a little on how the pandemic has affected Hubtown, us as owners, and everyone that we've worked with over the past 9 months as we navigated both our first year in business as well as a global pandemic that has essentially forced us to move in directions we had never, ever considered in an effort to survive. I think the best way to describe the feelings that have at times completely overwhelmed us and at other times sat almost mutedly and dormant in the background from the early days in March through now is to say that it's been a roller coaster. As each terrifying obstacle was put in front of us, like closing down our tap room, which was 99% of our revenue stream, or reducing the capacity to below survivable numbers when we were able to reopen. We seemed to follow most of the stages of grief, holding tight to some of those stages a little more while experiencing moments of elation and pride in between. Like jumping over hurdles that are each higher than the last, the obstacles that we face and continue to navigate have done a couple of things for us. It's forced us to find a lot of solutions, testing our ability to stretch our limits and to find new paths that we were never, ever in the plan, nor ever a consideration. And it actually managed to boost our confidence in our ability, teaching us that we and our business can survive more than we ever thought possible. The side effect of this, however, is that roller coaster I spoke of. We would fluctuate from panic mode, trying to find new ways of bringing in revenue, when those who provide the revenue to us were being coached to stay home and avoid us, to pure elation when we would find that unexpected revenue stream that shot us into almost rock star status with our target market. But what never changed was the mental and physical anxiety that came with each of the highs and each of the lows. The weird new habits that I've taken up, like chewing on ice all day long, I can't even explain where it came from, but the anxiety just produced that desire to crunch on something constantly because there was no other way of getting out what was going on. To waking in the morning with a racing heart, wondering what was in store next. good or bad. As I began to work through what I think I was identifying for the first time in my life as anxiety, I would have conversations with my husband and business partner, Mark, picking apart every daily update from our federal and provincial governments that we worried once again would threaten our path. These conversations spilled over into talks with other business owners, our staff, our patrons, our families, our friends, teachers, nurses, you name it, we talked about it. If it wasn't on TV, it was on the radio, and it never left our brains. Even a couple of days ago, when we tried to disconnect from TV and radio and talking about the pandemic, we went shopping at Costco and noticed a flurry of shoppers on a Tuesday at 4 p.m. In our town, this is abnormal. And then immediately, we knew something must have happened on that daily update to cause some panic, and we had better listen to it to see how our worlds were about to change once again. Now, if the anxiety and elation were the only two things, the only giant swings that we had to manage throughout the pandemic, I think we would have been a little better off. But throw a little anger and resentment, and you have the third and fourth valleys of our roller coaster ride. As a business, we are subject to criticism and jealousy like everyone else. And when we were positively growing our business during the pandemic, when many were suffering, and we were trying to dodge the obstacles, so too came the anonymous complaints. This would mean our AHS inspectors would come to see us, measure that all of our tables were 6 feet apart back to back, reconfirm for the umpteenth time that we had sanitizer available for everyone there, and of course that our staff were all wearing masks nonstop. It didn't matter to the rest of the rest of the world didn't wear masks to protect us and our staff, nor brought their own sanitizer, nor asked to sit further away from people, but would rather sit closer, if at all possible. And we as a business were responsible for ensuring the world didn't infect each other. And we somehow had to do this without angering them to never patronize us again. This was and always will be the hardest position us and our staff have ever had to be in. We were heavily judged for not forcing people to mask when there was no bylaw, and we were heavily judged for having a sign up reminding people to wear masks when the bylaw became a part of our reality. It was a lose-lose, and we had to coach our team on how to deal with each and every attitude that walked in the door, when honestly, we didn't know what the heck we were doing, not ourselves, nor did we know what the right thing to do was. The inconsistent rules between businesses and schools helped further grow our anger and resentment. And although we continued to ride the roller coaster of highs and lows, the anger was drowning everything else out until just over a month ago when we hit bottom. Now, let me just say that I've never had my own experience with depression before. In fact, I was that person that said depression was an emotion we could probably all control. We just needed to want to try. So when my anger hit an all-time high and was followed by the feeling that I could barely think past 20 minutes ahead, nor did I care to, I realized I may be experiencing this depression thing. My motivation to figure out how to manage the next obstacle was gone. My desire to find a new revenue stream in light of all of the items that come in and we're putting in our face was gone. I was tired and wanting nothing more than to just stop.
Ms. Watts, could you please wrap up?
Sure. This is when I said aloud, whatever happens will happen. With teenage and adult children, aging and lonely parents, and a business that was impossible to predict from one week to the next, we finally got off the roller coaster and sat still for a while. No planning, no ideas, no solving problems, nothing, for just a little while. And although writing this down has kind of brought a lot of those thoughts and feelings back to the forefront, I think we're finally starting to get into a place where we can figure it all out, or at least believe that we have the capability. So in summing it all up, how this pandemic has affected us, I'll always go back to the visualization of that roller coaster. and all that it brought, the good and the bad. And I hope that what we've gained from this experience always outweighs the losses in the end, because there's been a lot of both. Thank you.
Thank you, Ms. Watts. We'll go now to Mosaic. Salim Spindari, Senior Manager, Refugees and Migrant Workers Programs. Please go ahead.
Honorable Ron McKinnon, Chair of the Standing Committee on Health, honorable members of the Standing Committee on Health, it's an honor to appear before this esteemed committee. Before I begin, I would like to acknowledge that I am speaking today from the unceded ancestral territories of the Coast Salish people, namely Musqueam, Tsleil-Waututh, and Squamish First Nation. I'm honored and privileged to have the opportunity to play, live, and reside on their land. My name is Salim Spindari. I'm the Senior Manager of Refugees and Migrant Workers Programs at Mosaic. Mosaic is one of the largest settlement nonprofit organizations in Canada. We serve immigrant, refugee, migrant, and mainstream communities in Metro Vancouver and the Fraser Valley, as well as throughout the province of BC and overseas via online programs. Mosaic's work is derived from its vision that together we advance an inclusive and thriving Canada. At Mosaic, I oversee programs that support migrant workers, refugee claimants, privately sponsored refugees, international students, and other marginalized groups. I will provide brief remarks about the impact of COVID-19 on these groups. In early March, I received a notification of arrival from Immigration, Refugees, and Citizenship Canada that one of the families that Mosaic is privately sponsoring would arrive in early April. A visa was issued and travel arrangements were made. Here in Vancouver, we made all of the arrangements for the arrival of the family from Africa with the help of a host family that volunteered to provide support to the family upon arrival. Then travel restrictions were imposed and the flight was canceled. This had a huge impact on the mental well-being of the family as it continued to live under deplorable conditions in the refugee camp. The government recently allowed privately sponsored refugees who had their visas issued prior to March 2020 to travel to Canada, but many others are still waiting. Most of the visa offices overseas are still closed, and this is having a huge impact on the life of refugees that are waiting and have sponsors ready to welcome them. In British Columbia, we are fortunate to have the first pilot to support migrant workers, otherwise known as temporary foreign workers. And I'm proud to be leading a community capacity building project to support migrant workers and groups working with them. This project that is funded by Employment and Social Development Canada has provided the much needed funds to support a group that provides immense contribution to our economy. Regrettably, the temporary nature of the migrant workers program makes them vulnerable, and it continues to break families. The impact of COVID-19 has been huge on migrant workers as they worry about their family members who are left behind. More restrictions are imposed on their movement. In many cases, they cannot even leave their places of employment, and they face difficulties meeting their immediate needs. I'm glad that the government is currently looking into creating guidelines for migrant workers' accommodation. It is a great first step, but much more is needed. I call upon the Government of Canada to extend funding to other provinces and to make the BC pilot permanent, as the project has been very successful in supporting the mental health, well-being, and other needs of migrant workers. The staff at my program have been able to meet migrant workers at their during their 14-day isolation while following health guidelines to help them and address their needs there. Refugee claimants who arrive before or during the closure of offices face challenges in finding accommodation, obtaining required documents to apply for benefits and employment, or to get a hearing date. All this had a huge impact on their mental health at a time when they are away from their families that they left behind while seeking protection in Canada. With funding from BC government, Mosaic has been working closely with other partner organizations to support the mental well-being of refugee claimants during these uncertain times. Of course, these programs are now offered via Zoom and MS Teams. In closing, I want to remind the esteemed committee that refugees, migrant workers, refugee claimants, and international students continue to make immense contribution to Canada's economy. I call upon Canada to offer a pathway for permanent residency to all migrant workers, as not all of them have that. If they are good to work here, they are obviously good to stay here. Those temporary residents and permanent residents who are internationally trained professionals should be given the opportunity to practice in Canada. They continue to prove that they are capable, willing, and have the skills needed to practice their professions. We have seen the contribution that they have made during COVID-19. I call upon the Government of Canada to ease the restrictions and remove the existing barriers toward their licensing. Thanks again for the opportunity to speak today, and I look forward to your questions.
Thank you, Mr. Spandari. Nous allons maintenant à l'ordre des...
We now have the Order of Psychologists of Quebec. Ms. Groux, President, go ahead. 7 minutes. First of all, thanks to the committee for having given us this opportunity to speak about the effects of the economy on mental health. I'm Dr. Grill, psychologist, a specialist in mental health. With me is, sorry, doctor. For the interpreter.
And the interpretation is at the same level. I'm on the English channel, so perhaps I made that happen by trying to speak French on the same channel. So I wonder if you could have a quick look and see if you could address that. Dr. Groux, s'il vous plaît, allez-y.
Oui.
So with me is Dr. Marleau, who is a specialized clinician in physiatrics. We're going to talk to you about the effects of the epidemic on mental health. And we have two aspects. First of all, an overview of research on mental health during COVID. And the second is our observations.
Persiste. Pour le clerc, est-ce que vous pouvez adresser ça?
Je vérifie.
I'm sorry to interrupt.
Monsieur le Président, si je peux.
Chair, if I may suggest, maybe it wasn't done earlier, but at the bottom in the menu, there is in the tab where you see participants, there's also the possibility of putting yourself on the French channel. That would mean that you listen to French translation and it doesn't have the same sound level as the English. So that may be the problem. That's often what we find when we have this kind of problem. So I don't know if that was done and whether you clicked on that tab. Doctor, would you mind checking?
Channel.
I just changed for the French channel. Is that all right? Okay.
Merci.
All right.
Allez-y encore.
Alors, nous avons...
Go ahead. So we looked at two aspects. First of all, an overview of research on the effect of COVID on mental health. And secondly, the impressions of our psychologist members looking at the deterioration of healthcare during the epidemic and the effect both in the public system and in the private practice. And both through the research and documentation and our own observations seem to agree. There is a great increase in anxiety, and we also know that people have had to adapt to a number of things that have just kept piling up. There is fatigue, psychological stress for most citizens, I would say. And we also have an increase in depression and depressive signs, loss of energy, lack of pleasure, feelings of inadequacy, discouragement, and difficulty to have any appetite, and other mental illnesses and more serious illnesses as well, including people who have cognitive loss because of age, and they have been further affected by the increase of stress. And there's also, for them, sometimes an interruption in mental health care because of the pandemic. And another phenomenon is an increase in alcohol and consumption and addiction and increased stress for health workers. A lot of studies show that there's a great deal more stress for health workers, and as well as the effects of a lockdown, increase in psychological distress, and also increase in feelings of giving up, discouragement. And for people suffering from COVID, in 95% of cases, we see some symptoms of post-traumatic stress when they leave quarantine. And for young people and elders, the elderly, affected by lockdown because of solitude, isolation, and the lack of activities or stimulation for the elderly, and not even being able to leave their homes. And for young people, the lack of social contact. When we consult our members, 86% of our members have noted an increase in anxiety. More than 50% saw more of their clients come back for treatment. 65% said that they had to manage crisis or emergency situations. 70% said they had an increase in depression in their clients, and somewhat less degree stress within relationships and parental stress, and increased in consumption of alcohol and suicidal thoughts. And something about virtual care. Telepractice studies show that virtual care is effective, and many psychologists had not used virtual or phone consultations. They found it very useful. 86 of them did, and they felt that it met the needs of the population. But more than half say that there does nevertheless have an impact on communication and interaction between caregiver and client. And things that we've done to support the population, we have, at the beginning of the epidemic, we published a general advice for maintaining your psychological health for parents, children, adults, parents of children with hyperactivity syndrome. And we also provided advice to people who look for workers in long-term care homes and who have had clients die from COVID, and we've worked to help the population understand the effects of COVID, and we've also published videos to help the population. For psychologists, we've had particular training for telepractice, for remote counseling, and for practical suggestions. We've communicated a great deal with our members for giving them tips and to support them in their practice, which is in this exceptional situation. And of course, we have contacts with the Minister of Health, Ministries of Health, Ministry of Education to adapt services to the needs of the population and to protect the population from the stresses caused by COVID. And just in finishing, it's essential that we can provide mental health care to the population, increased access to services, because there is a different kind of pandemic with regard to mental health, and this mental health problem will last, no doubt, beyond the end of the pandemic. So we have to increase service available for mental health and diversify mental health services to meet the needs of the entire population. And we, of course, have to include universal access to psychotherapy, which is something that has proved itself to be effective. Thank you very much. Thank you very much, Doctor.
Now our round of questions. We will have time for one round. Mr. Barlow, I understand you're first. Go ahead, 6 minutes, please.
Thank you very much, Mr. Chair, and thank you to our witnesses who are presenting to us today. And the timing of your presentation, I think, is very apropos as we saw the latest statistics released by the Canadian Mental Health Association yesterday, which outlined its latest statistics on the situation or the condition of Canadians' mental health. And I think the numbers were quite sobering when you see 70% of Canadians, or more than 70%, are worried about the second wave, and 40% have said that their mental health has deteriorated since March. But even, when 1 in 10 Canadians is having suicidal thoughts, I think we have a very serious problem that we need to address. And Ms. Watts, I really appreciated your intervention and the passion and obviously the feelings that you've had as a small business owner. And I think that is one area that we do not talk enough about is the impact this is having on our small business owners. Is this anything that you've ever experienced, in your previous career before getting into as a business owner or as a business owner? Is this the mental health impact on this as a business owner been like nothing else you've ever experienced by the sounds of it?
Definitely a different experience. I mean, I've been in non-traditional careers my entire life. So I was in oil and gas as an engineer, a pipeline specialist actually. So working on the Trans Mountain pipeline, trying to certify it for fitness for service. And there was always lots of arguing and lots of things that were quite difficult from if you want to look at a mental health perspective. There was always challenges to what we were putting in place to try and protect the pipelines. Because they didn't make money. They, in the long term, saved money, but there was a lot of challenges there. So there was always something that I've had to work through in my professional life, because that's just the nature of the businesses that I was in. This took me to a different level. I think I'm extremely passionate and I'm extremely motivated, and I'm able to find solutions in the worst of situations. But when the solutions were piled on top with more problems and more problems and more problems on top of just being a brand new business, I think there's just a breaking point. I never knew that I had a breaking point, to be honest with you. I never knew that was in my makeup. I just was not that person. So sure, different than anything else.
I'm assuming in your as a business owner, you have a network of people who are in similar positions. I'm going to make the assumption that you are not alone in this, that this is a very common situation amongst business owners throughout your community and maybe your network across the country as a craft beer owner.
Oh, absolutely. We're watching other breweries shut down right now. simply because the narrative that's out there is, why are we allowing alcohol producers to be open and schools to be shut? How dare they want to make money during a pandemic? How dare they not protect the public? So yeah, we're watching the people in our industry close their doors because of the narrative is very harsh. It's difficult to balance the desire to bring in revenue and the requirement to protect the public's health. When we talk with other business owners, there's no question, we have all cried. We have all screamed and yelled and wondered, how in the heck are we going to get through this? It's probably more than most can handle.
And by the sounds of it too, you're talking about a lot of the unknowns, just not knowing what's going to change, and when the changes do happen, how quickly they happen. We
For
see
sure.
other countries, for example, have access to rapid testing, home-based testing, and now we see, the United Kingdom, the United States, ready to roll out their vaccines and have that distributed to its citizens. What kind of difference would that make to you as a business owner if you had access to rapid testing, if Canadians had home-based testing, that you were able to see, a pathway to recovery and keep your business open on a more predictable way?
Oh, it would be immeasurable. I mean, for obvious reasons, what we're looking for is for the public to feel confident in whatever decision they're making. And that comes with knowing that they're healthy and the people around them can determine if they're healthy. So yeah, that is a critical piece of the puzzle.
Thanks, Lisa and Ms. Watson. And Mr. Kurdiak, I hope I pronounced that right, Doctor. You were talking about some of those mental health statistics. What kind of an impact is that lack of information, or just not knowing, in terms of, when access to a vaccine will be available, for example, or the ability to have home-based tests? Is this having an impact on the mental health of Canadians? As I mentioned, those statistics that were released yesterday, I find very disconcerting, and we need to provide solutions.
Well, I think you've heard lots of testimony today about the impact of the general uncertainty of the pandemic. The consequences of social isolation. Ms. Watts testified eloquently about, the financial stresses of small business owners and the financial stresses of most households, to be honest. So to add on top of that, obviously the certainty of knowing when this will end would help immeasurably. But to me, that this is a tough question to answer, because of course this is also a public health crisis. So I think balancing needs is kind of what contributed to Ms. Watt's roller coaster.
Thank you very much.
Mr.
Thank
Barlow.
you, Mr. Chair.
We go now to Mr. Van Bynen, please. Go ahead, Mr. Van Bynen, 6 minutes.
Thank you, Mr. Chair, and thank you especially as well to our witnesses for sharing their experiences and their expertise with us. I was happy to hear Dr. Kurdiak talk about the importance of accurate data, and I think it's critically important that we do have this new infrastructure so that we're making sure that we're doing the right things as much as making sure that we're doing things right. I think that's a very critical decision point that we need to give some consideration to. And we certainly are facing a harsh narrative, but the situation itself is very harsh. We're facing an unprecedented pandemic, and so it's important for us to be strategic and surgical in the way we approach things. My first question is to Dr. Kurdiak, and I recently met with our youth council, and during introductions, I asked each of them to outline the areas of concern to them. And as you can imagine, most of them said mental health, and it's my understanding that KMH has recently released a report outlining the results of a survey on youth mental health in Ontario. Could you please share with the committee some of the findings of this survey, and based on these findings, what some of your recommendations would be?
So the first thing, thank you for the question. The first thing I would say is that the KMH is a large place. I wouldn't know the specific details of that survey, so perhaps you could share them. What I can say is that before the pandemic, we have been monitoring closely the youth, and I think what's happening in youth is complicated. I suspect there is something going on pre-pandemic about the weird circumstances of this generation being steeped in social media like we have not. Sociologists and anthropologists have more to say about that than others. But we definitely noticed around 2019 this dramatic uptick in help-seeking behavior amongst 16 to 24-year-olds that just keeps going up and up and up. And I am quite concerned. In my clinical work, I work in a psychiatric emergency department. In my clinical work, we are also seeing dramatic increases in presentations amongst youth. So I think that the issue is that as I said, the mental health system has never been particularly responsive to need. The entirety of the work that came out of my team in Ontario suggests that there really isn't a system. And so, you could choose many populations to focus on. I think transitional age youth is as good as any because of the kind of work that's been documented by surveys and by the phenomena that we're observing in our provincial data. But I think the equally important thing is if we choose to intervene in a particular area, we have to do so in a way that allows us to iteratively measure. In other words, learn consistently as we go, like what happens in cancer. Every cancer patient in Ontario not only benefits from evidence, but contributes to it precisely because information is routinely collected and used to constantly improve. And that's kind of what we would like to see happening and are building towards in Ontario.
I see you're referencing the ICES, and I've received a summary of their report. I'm wondering if you might just expand on the mental health addiction system and the performance indicator that's included in the material that was circulated.
Yes, thank you for the question. So there are many indicators, but essentially what we see at sort of a meta level is over time, in Ontario and in every province and territory, there's a fixed number of hospitalization beds. So hospitalizations are going up a little bit, but because they're a fixed resource, the only way they can go up is if you reduce the length of stay. So we're seeing a slight increase in hospitalizations with a slight decrease in length of stay over time. And if that gets squeezed more and more, we're going to start seeing adverse consequences, bounce backs, and et cetera. We're seeing a relatively flat rate of outpatient care to the extent that we can measure. And I have to apologize, we do not have information from psychologists like my colleague, Dr. Grew, discussed. This is just physician-based care in Ontario, for which we have data, but it is flat. And then we come to the emergency department and we see between 2009 and 2017, a 35% increase in demand. And in that 16 to 24-year-old category, we see a 100% increase in demand, a doubling. And so all that tells me is that this system is constrained. There is not enough resources. And people are going to the only place they know, which is the open door of the emergency department, which, by the way, is not a particularly therapeutic environment for people in crisis.
Thank you. And I think this goes back to reinforcing the importance that you place on data, in order that we are strategic and surgical, where we get the best results for the resources that we apply to that. I'd also like to now go to Mr. Spenderi. In an effort to slow the spread of the COVID-19, we're encouraging people to stay physically distanced, stay at home, and staying connected virtually. And as discussed in a recent interview with the CBC Vancouver and Mosaic CEO, Ms. Stachova,
yes.
Stachova. Some families and individuals in vulnerable communities face a digital divide. So how has COVID-19 impacted these families and this divide? And what is the impact that that's had on their mental health?
Very quickly. Thank you. Please, a quick answer, please.
Okay. Thank you very much. Thank you for the opportunity. And this is one of the challenges when we are told to maintain physical distancing. For you and I, it's easy to do. We stay indoors from our offices. For migrant workers, actually, that's not a possibility because they tend to live in group settings and accommodation. Normally, there is not huge there. What we have done within our organization in terms of the digital inequity that's available out there is to partner with great organizations such as the BC Technology Learning Society to provide free refurbished desktop computers and to refugee families and to migrant workers to be able to use that. And after our CEO, Olga Stakhova, issued the plea for people to offer us, we've received really great support and from the community to provide smartphones and used ones, of course, so that people have access to technology to be able to access online programming. Thank you.
Thank you.
Thank you, sir. Nous allons maintenant à Monsieur Thériault.
We will now give the floor to Mr. Thériault. Go ahead, you have 6 minutes. Thank you so much, Mr. Chair. I would like to thank all witnesses for their very good presentations to face this problem. So I want to talk first to the Ordre des Psychologues du Québec. Thank you for accepting our invitation. I imagine that sooner or later we'll have access to your written presentation. I look forward to reading this study. Before asking the questions, I would like to hear Dr. Marleau. I just want to ask her the question. With all these data on adults, how are youth behaving or children? Do you also have data on these two other groups? Less data on children and teenagers, but the trend is the same as for the adult groups. More mental health problems, anxiety, depression. For teenagers, we have some data, partial data. When we talk about data, we're talking about a couple of studies, small sampling, and these have been done over the last 5 to 6 months. What we can say is that the trend is very clear. For teenagers, we do have some data, and the trends are the same as for adults. And there's also a little problem of consumption in this age group. Dr. Groux can add to this. Go ahead, Dr. Groux. Otherwise, I have another secondary question. You talked about virtual practice. Your members thought that the inline consultations were efficient, but still, there is still a problem given the interaction while offering a treatment. Can you tell us more about that, HESA? So on the long-term basis, it might not be a good practice. It's better than nothing currently, but it's not a practice that is actually complete to have a better relation. There are some advantages in being online. It's safe, and some people won't consult because they can't come physically. So there is some advantage in offering online service. Our members are getting used to it now, and almost everyone has gone virtual. 60 to 65% will still say that it does have an impact on communication. It depends on the type of client, how familiar they are with the technology, what is the mental health problem. Did we already have a relationship with that person and temporarily we're going online? In other cases, we start online. So we must study this further and research telework. But the data we have up to now indicates to us that it does satisfy most of the population who needs those services. There are some advantages, but some inconvenience too. I can.
Oups, j'entends la traduction anglaise. Là.
Moi aussi, c'est
Sorry. I imagine that a patient in the office with the, I'll repeat that, sorry, during that time. A patient in a relationship of assistance in with a therapist versus a patient in their own family situation with people around them moving in and out, and in a telework situation, I imagine that that there's a substantial difference. One of the challenges we had with the pandemic is that in telepractice, it can be difficult for people who were confined at home with their spouse and children. So it's difficult because you have to have a space that's confidential, calm and quiet for a period of consultation. So that is one challenge, but can also be relevant, for example, for a single mother who is going to bed in the evening or doesn't have a babysitter, or somebody who's a farmer who has to drive for 2 hours, but they can use telepractice, or otherwise they would lose half a day of work. Otherwise, it can be difficult for someone who has serious mental problems, or someone who is elderly and is unfamiliar with technology, or someone who has a greater need of proximity in the relationship. But I could say that in general, it is a good, positive surprise, telepractice. You suggested that universal access to psychotherapy is something that would be worthwhile in the context where, in the pandemic, you have to draw lessons from it. Please remind us why it's not universal psychotherapy once again. Well, actually, at present, of course, in terms of mental health, you have to understand that mental health is always the poor cousin compared to the rest of the health system, and you have to see health from the viewpoint of overall health. So we cannot underestimate the effects of mental health on overall health of the population. What's being said is that currently there are two possibilities of having psychotherapy treatment. One through the public health network, but it's not easily accessible, and the other one in private, but unfortunately not everyone can afford it. So we would have to have financing so that everyone who has a mental health problem can be treated. Of course. Thank you, Mr. Thériault.
Davies, please go ahead. 6 minutes.
Thank you, Mr. Chair, and thank you to all the witnesses for your testimony. Mr. Spinderi, thank you for your testimony about the impact of COVID on the mental health of some very vulnerable populations, refugees, international students, migrant workers, and immigrants. I know that in June, Mosaic launched a survey seeking input from refugee claimants in British Columbia to gather information on how to enhance services during COVID-19. Can you tell us, are services currently meeting the needs of refugee claimants and their families? And if not, what steps the federal government can take to enhance them?
Thank you very much, Mr. Davis. We did issue the survey, and the response was really great from the refugee claimants population. Throughout the province of BC, we try to reach out to as many people as possible. As you know, refugee claimants are still not eligible for services funded through the federal government. We rely on provincial funding to do that. So maybe the best thing to do is to extend for the government of Canada is to extend services that are offered through IRCC to refugee claimants as well, so that they have access to it. We heard loud and clear that there is a huge need for mental health support. We did hear that housing is one of the big things that refugee claimants encounter in terms of coming in, because upon arrival, it would take them a while to get documentation from IRB and Immigration Refugee Board. And as you know, that moving toward virtual services and for the refugee claimant, it was an additional challenge not having access to technology or being able to reach out to somebody in person, whether it's Canada Border Service Agency office or the Immigration Refugee Board to get an ID document, it had a huge delay and impact on refugee claimant being able to access services and of course, and later to get work permits so that they can find employment in BC.
Thank you. Now, more broadly about immigrants generally, Mosaic's recently released 2019-2020 annual report said the following. It's a shocking statistic. 5 years after arriving in Canada, the average newcomer is generally in worse health than when they first arrived. Factors impacting the social determinants of health after immigration include poor living conditions, social isolation, unemployment, and challenges adapting to a different language and culture. Now, clearly, COVID-19 would have exacerbated, I think, those exact factors. So in your view, what steps should the federal government take to break down barriers to newcomer health more broadly?
Well, recently in BC, they have started Community Health Network. And for me, that's a really great first step. And Mosaic has been really active in working with partner organizations and group in order to be able to do that. I encourage the federal government to work closely with provinces, and especially in the idea of having community health centers that are there, providing more funding to organizations to be able to carry out the much needed services that newcomers need. And as you know, at Mosaic, the majority of our staff are people with lived experiences, and we do have individuals with background in the health sector. The senior manager of our specialized program, for example, herself is internationally trained medical doctor. She is not practicing here in Canada right now, but
like many
with the experiences like many others as well.
Mrs. Madera, could I just stop you there because I just want to get one last question because I'm running out of time. Because I want to turn to an important area on mental health, and that is, in the first 9 months of 2020, the Vancouver Police Department reported a 116% rise in hate crimes in Metro Vancouver compared to the same period in 2019. So I'm just wondering, with many immigrants and refugees coming from different areas of the world, being from racialized communities, what has been the impact of that increase in race-based hatred in your experience? And do you have any suggestions for what we could do to address it?
And at Mosaic, we do our best to raise awareness around issues of racism and that people are targeting. I think recently the provincial government, for example, started the Resilience BC, and there are so many initiatives that are coming. I encourage the federal government to do the same, to work with organizations that are there. The messaging that comes with the politicians, it sometimes does contribute toward raising tension, and we know clearly that down south, whatever is happening there, it has influence in the messaging and the response that people are having here as well.
Thank you, Mr. Davies.
Thank you.
That wraps up our questioning on this panel. I'd like to thank the witnesses for giving us your sharing with us your wisdom and your expertise and your knowledge, and for sharing with us your time today. And with that, we will suspend as we bring in the new panel. Thank you, everybody. To welcome our witnesses on this panel. Today, for this panel, we have as an individual, we have Professor Charlotte Waddell, University Professor, Children's Health Policy Center, Faculty of Health Sciences, Simon Fraser University. We have for Natural High Fitness and Athletics, Andrew Gustafson, owner-manager. Mental Health Research Canada, John Traynor, adjunct lecturer, Department of Psychiatry, University of Toronto. And with Statistics Canada, we have Jeff Latimer, Director General for Health, Justice, Diversity, and Populations, and Ron Gravel, Director, Center for Population Health Data. Just for the benefit of the witnesses, witnesses may speak in the official language of their choice. Interpretation services are available for this meeting, and you have a choice at the bottom of your screen of either Floor, English, or French. And I would encourage people who wish to speak in either official languages to make sure that when they're speaking in that language that they are on that translation channel. Before speaking, click on the microphone icon to activate your own mic. And when you're done speaking, please put your mic on mute to minimize any interference. And remind you that all comments by members and witnesses should be addressed to the chairs. And with that, we shall get underway. Witnesses will have 7 minutes for a statement. So we will start with Professor Waddell. Professor Waddell, please go ahead, 7 minutes.
Thank you so much for the opportunity to speak with you this morning, this afternoon, about COVID-19 and children's mental health in Canada. One basic message, perhaps the most important, is that pre-pandemic, children's mental health needs were extremely high. Looking at epidemiological evidence, we estimate that 13% of children aged 4 to 18 years at any given time, or 800,000 young people in Canada, were experiencing mental disorders pre-COVID that needed treatment. Those disorders include 12 common ones, such as anxiety, attention deficit, behavior problems, substance use, depression, autism, through on to schizophrenia. And we know how to intervene for all these disorders, but pre-pandemic, fewer than half of these children were actually receiving any interventions for these conditions. So shortfalls that we would never accept for physical health problems like childhood cancer or diabetes. So pre-pandemic, we already needed to double down on children's mental health services. The second major point is that needs are expected to rise significantly during and after COVID. Based on data from previous disasters like SARS or natural disasters like earthquakes or floods, we may see as much as 2 to 10-fold increases in problems like childhood anxiety, depression, and behavior. Making things worse, some kids will be more affected than others. So, for example, families that were already experiencing economic hardship are expected to suffer more greatly and already are during the pandemic. Children who had pre-existing mental health and developmental conditions, even if they weren't getting adequate services, they've now had disruptions in what they were getting. Racism is another issue that affects children's mental health, pressing issue for all Canadians, but there have been flare-ups during COVID, anti-Asian racism, for example, and Indigenous communities, another group that will be severely affected. They were already coping with the legacies of colonialism with strength and resilience, but now they're coping with COVID with fewer resources than other Canadians. So needs were high before, needs will rise a lot. But even though this is an unprecedented public health challenge in Canada and globally, there are still some unprecedented policy opportunities, and I want to highlight 3 where federal policy leadership can be crucial and can make a huge difference to addressing these problems. The first policy opportunity involves making a plan. We haven't done this. Make, implement, and sustain comprehensive children's mental health plans nationwide. Comprehensive means covering all kids, 0 to 18, covering all 12 common mental disorders at a minimum, looking at promoting healthy development, preventing disorders, and treating all the kids with disorders, as well as tracking our outcomes. And federal leadership, in my view, is crucial because it's the only way to coordinate efforts nationwide to keep kids on the national public policy agenda. The federal government can also offer economic incentives for children's mental health programming to provinces and territories, building equitable access across the country. We've done this before very successfully. In the year 2000, the Early Child Development Accord led to funding going out to provinces and territories with strings attached. The benefits have been enduring. We need to do that now for children's mental health. Second policy opportunity involves ensuring adequate budgets and effective services. If we're going to meet those pre-COVID shortfalls at a minimum, again, we need to double down. We need to double children's mental health budgets. That's to treat all kids with disorders. And we know how to do this, know of effective interventions. The question is obvious, how do we pay for this? And here's where the promise of funding new prevention programs also comes in. For example, preventing just one case of a severe childhood mental health problem, like conduct disorder, can yield lifetime savings of up to $8 million. Similarly, a prevention program like Nurse Family Partnership starts in very early childhood, has shown to improve child mental health, yields benefits of over $6,000 per child when you look at whole of government savings, services not needed because of this program. So there's potential there to start to pay for some of the increased costs that we need to incur. And addressing social disparities will simply help with all of this, and the federal government has already been showing leadership there. The third opportunity is to track our collective progress. Quoting Clyde Hertzman, what gets counted counts, and we haven't been counting our kids very well. How else do we know how we're doing? So it's tracking child outcomes is essential, and it's also a way to measure success as we ramp up these new investments, presuming that we could. And we have a unique opportunity. Statistics Canada's very high quality 2019 Canadian Health Survey on children and youth. It's one of the few data sets in the world where comprehensive work was done pre-pandemic. We can and we should repeat that survey ongoing, and it would position us as a global leader to be able to track those outcomes. The federal government is ideally situated to support that survey continuing. So just to conclude, I recognize many competing demands right now on public budgets, but I would say if we don't address children's health now, we're going to have far greater societal costs down the road if these problems persist unabated and unnecessarily into adulthood. Annual costs are estimated to be at $68 billion in Canada for mental health problems writ large. But beyond the economic costs, if we don't address this, we risk seeing a generation of young people scarred by this pandemic to our great collective detriment. We need this generation. These are our future frontline workers, nurses, teachers, doctors, future parliamentarians. So they need children, and children's mental health need to be at the front of the line in our pandemic response. And I'll just end with a quote from the Lancet medical journal. Although the COVID pandemic has threatened child health, it can also be a catalyst to start afresh. Children's rights must be central to the recovery phase. Thank you.
Thank you, Professor. We go now to Natural High Fitness and Athletics. Mr. Gustafson, owner-manager. Please go ahead, sir. 7 minutes.
Yes, thank you, Mr. Chair and committee members. Let me just begin by saying that, I have no license to speak for business on large. I'm simply a business owner, and so I really thank you for the opportunity to speak today about my experiences as a business owner, but more specifically to speak to my state of mental wellness, and hopefully my state and my story can bring some light to what others might be feeling as well. It's not something I've really spoken about before, and certainly not publicly, but the mental health of business owners in 2020 is fragile, I think, and needs to be considered. So this is a great opportunity, and thank you for that. Let me begin by saying I am not fine. This is not a cry for help. It's just me being sort of vulnerable and truthful. I'm not fine. There are moments when I'm okay, but truthfully, I float on a spectrum anywhere between okay and completely miserable. And that's not a description of my mental state between March and today. That describes me minute to minute, hour to hour, day to day. Business owners are facing a myriad of emotions based on the ever-changing daily reality. People have their fingers resting squarely on their subconscious panic buttons, ready to push and explode at the smallest of triggers. We have a national heightened readiness for interpersonal conflict. And so I'm walking an emotional minefield every day. One wrong word, misstep, misinterpretation risks an explosion of emotions. And so we're all a little compassion fatigued. And when speaking of mental health, the bigger terms that come to mind for me as a non-expert are anxiety and depression. And all these words are sometimes a little too lofty, they're too clinical. They do, I think, accurately describe the current mental state of many in the small business world. Other words are emotional exhaustion, worry, doubt, loneliness, anger, frustration, insecurity, fatigue. These are words that describe the emotional roller coaster that I'm riding every day. And I'm a well-adjusted, well-supported, stoic, and strong person. And I believe that for a proud person like a business owner, one of the biggest challenges is to admit that times are challenging, to engage in a conversation about these types of feelings. And so I believe that the situation is likely understated. And dealing with my emotions is so low on the triage list right now that I kind of risk spiraling, I think. Because the more pressing matters at hand for me are supporting my kids in their now online school reality, sharing my office space with them so the time I do have to dedicate to creativity in my business is disrupted, supporting my household both emotionally and financially, such as paying a mortgage without a secure income, and ensuring that the 30 staff and contractors that depend on my sound business management aren't themselves feeling the brunt of this crisis. The primary weight of this is carried by me as the owner. And let the truth be known, I'm only surviving right now due to the generosity of my landlords. It's a generosity that can't possibly last much longer, which piles further anxiety onto me at an almost suffocating level sometimes. I see no clear and precise mental health picture that can be painted for this committee because every corner of our nation and every demographic is facing different challenges and is equipped to deal with those challenges in different ways. I've heard over and over that we're all in the same boat. That is not true. We are in the same storm. Some are in a luxury yacht, others a rickety sinking canoe. But the important point to remember, in my view, with all respect to everybody else on the panel, is this is not an academic exercise. This speaks to real people, real business owners like myself, real thoughts and feelings that I'm thinking and feeling. The belief that the best cure, my belief for the best cure, that the best cure for this anxiety that I speak to is information. This has been sorely lacking. It's unclear to me, but it seems likely that biases in today's media are hindering the accuracy of information reaching the public's consciousness. The burden of fact-checking currently rests at the hands of the populace. So the fact or the lack of timely and possibly accurate information is the norm. We've been told that before restrictions can be lifted, we need mass vaccinations, but we don't have a timeline for that. And so we ready ourselves for continued restrictions and the threat of further lockdowns. And we have no cases at our business, no confirmed transmissions, and yet we have further lockdowns. Perhaps there's more subsidy and relief coming, but when and for how much? The information we have is not enough to squelch this underlying anxiety. All of this leaves me feeling very uncertain for my future. Not my long-term future, but the viability of my business over the coming few months. Do I follow my 10-year capital replacement plan and invest in needed infrastructure upgrades, or sink money into repairs until such time as I regain confidence in my cash flow? I don't have enough information or trust in the information that I do have to answer that. And at this point, our best prediction, if everything went fully back to normal today and my revenues and expenses returned to pre-COVID levels immediately, the borrowing coupled with lost revenue of 2020 will require a 7-year recovery for us. I've been applauded in my community over the years as being a generous supporter of local initiatives. I've long believed that business involvement is an integral part of the community fabric, and that's not a reality anymore. And I don't know when or if it will be again. I'm losing my community perspective as I struggle to focus on anything beyond my bank account balance. What are the long-term community ramifications if more businesses are feeling that same pressure? These are the things that bring people together. They provide purpose and satisfaction, pride in owning a business that makes a difference. So losing this is another trigger for further anxiety and possibly depression. I have constant and I have real stress. I'm consistently reinventing my business, which takes energy and resources and creates a stressful dynamic for my members and staff who simply long for stability and job security. My staff and their families are depending on me to make this work. And at this point, I have very little confidence that I can. I need to feel confident that a lockdown is not forthcoming. I need my local, provincial, and federal decision makers to know that our actions and responses as business owners at large are virtuous and seek the right balance between our needs and the needs of the public. I need information, specific timelines, and continued recognition from my financial insecurity so that I can regain control of my planning and hopefully mitigate some of the emotional exhaustion that I've been suffering for many months. And I need the powers who drive the message around COVID-19 to acknowledge the damage they've done to my entire industry through their destructive painting of my industry as dangerous, such as the recent misguided targeted measures aimed at restaurants and group fitness specific to me. These challenges are immense. The decisions are difficult. I understand that, but we can't come to a difficult conclusion without the involvement of us, those that are affected. this hasn't felt like a common practice in 2020. And so to have this opportunity to speak feels like a step in that direction. And so I thank you for your attention.
Thank you, Mr. Gustafson. We go now to Mental Health Research Canada. Mr. Trainer, Adjunct Lecturer, Department of Psychiatry, University of Toronto. Mr. Trainer, please go ahead, 7 minutes.
Thank you very much. I appreciate being invited to speak with you today. I am the chair of Mental Health Research Canada, which is a national charity that's dedicated to advancing knowledge in mental health. And today I offer some comments about mental health in the pandemic. And I also want to outline the COVID-19 mental health polling project, which our organization has been involved with. In addition to my brief remarks, I submitted a report to the committee, and my organization is happy to offer briefings to any committee member on further details. First of all, let me applaud your committee for focusing these hearings on mental health and listening to a wide range of views. Our organization is also fundamentally committed to listening to stakeholders as a way of determining what kinds of knowledge need to be developed to support mental health. For us, stakeholders are not just professionals and researchers, but a much wider range of people, including family members, those who directly experience mental illness, Indigenous people, and people at high risk for reasons such as racism and discrimination, as well as many other examples. I am sure that you as members of Parliament are hearing a great deal from your constituents about mental health issues, and this is extremely valuable information. Good information on how Canadians are coping is really essential to dealing with this crisis. When the pandemic hit, we committed our organization to helping with the crisis. We launched a national polling initiative to provide good and timely data to governments and stakeholders on the mental health impacts of COVID-19. And to date, we've conducted 3 polls, and a 4th poll is being started today as we speak. When it's done, we will have engaged more than 10,000 Canadians and developed an extensive and complex data set. And we plan on continuing this work every 8 weeks into 2022 to monitor Canada's recovery. Our work is enabled by its scale, because only with large samples can we be sure to get sufficient data in the many areas that we explore. Now, we're looking at a number of things. We're looking at types of distress people are feeling, fears that they have, how they're coping, demographic data on such things as family status, income, employment, gender, and also access to mental health supports, as well as other areas. So here are some headlines from what we found. High levels of anxiety have quadrupled since the start of the pandemic, and high levels of depression have doubled. Surprisingly, these levels have not moved substantially from April in wave 1, despite changes between the waves and then the onset of wave 2. The levels of distress have remained pretty constant across the country. High anxiety and depression levels are more prevalent in younger populations and in women. But there's a surge of men at the very highest distress categories when looking at symptoms. And we know from other work that men often do not report mental health challenges until they become quite severe. Treatment is now harder to access. There's been a drop in one-to-one counseling, and visits to family doctors have been dramatically reduced. And I should note that we are sharing all of the above information with governments and professional associations across Canada. Looking broadly, we can see that levels of distress are not evenly distributed in the population. People working in certain sectors, retail, frontline healthcare, teaching, I think I would add small business, having heard Mr. Gustafson, are more anxious. Family situations are also important. We find that people living alone and those with small children are dealing with more anxiety. Finally, lower income levels predict more distress. And with that information, we are taking it and sharing it with governments, professional associations, school boards, and others. People who are adhering less to social distancing guidelines are experiencing increased depression and negative mental health, particularly around the economic fallout of the pandemic. If we look at coping, we find that social media and watching the news do not help most people. Activities such as reading, exercising, or interacting even virtually with friends were rated as helpful in the early stages of the pandemic, but are now losing their positive effect as we exhaust their use and find them repetitive. Canadians now rate going outside or spending time in nature as the #1 helpful activity. And we're sharing this finding with parks and recreations organizations, provincial and municipal governments, and others across the country. It's also important who is delivering the message. Canadians want to hear information about mental health from professionals. This includes doctors, like those from the Public Health Agency of Canada or their provincial counterparts or territorial counterparts, but also local family health providers and doctors. The messages themselves need to be accurate, but to emphasize hope and advice on how to cope. So what do we suggest in the long run, or in the medium term, I guess? First of all, it's important to keep trust high. Our national response to this, looked at globally, has been quite coherent, and especially and dramatically in comparison to the United States. Continue to build knowledge. Our data is part of a mosaic of information that's being built by many organizations. And from this, we now have a unique and replicable data set on how specific groups, including at-risk groups, are responding to mental health stresses during the pandemic. We need to share this and keep dialogue open. Those living alone, younger Canadians and lower income Canadians, as well as those with pre-existing mental health challenges, are all groups we need to focus on. And the work of Wellness Together Canada, which is serving as a hub with information and resources for those who need help and those who care for them, is an important resource that is, I know, supported by the federal government. So let me say thank you very much for inviting us to appear. We will work with you in any way we can to help with the response to COVID and to support the mental health of Canadians. Thank you.
Thank you. We go now to Statistics Canada. Mr. Latimer or Mr. Gravel, please go ahead, 7 minutes.
Thank you very much, Mr. Chair. I appreciate the opportunities of public servants to appear before such a committee. At Statistics Canada, we have been tracking the direct and indirect consequences of this pandemic on Canadians. And the one thing we've observed in the recent period is an unprecedented reduction in self-reported mental health of Canadians. But this reduction is actually not evenly felt across the country. And I think my colleague, Mr. Ron Gravel, will present to this committee a series of statistics related to the varying impact of the pandemic on particular population groups. And I'd like to ask Mr. Gravel to finish the presentation. Thank you.
Thank you. So by referring to the impact, this impact can be experienced in many different ways, including feelings of depression, grief, fear, panic, and anxiety, which can be normal responses to situations where day-to-day routines are significantly disrupted. It's important to note that today's presentation focuses on data collected in the first few months of the pandemic, that is the first wave. The overall presentation provides a profile of how the impact on mental health has varied across a number of demographic and social groups. These includes youth, immigrants, groups designated as visible minorities, gender diverse population, Indigenous, and Canadians with disabilities. So I'm referring now to the slide 2 of my deck. Since there are many graphs with details in this deck, I will first start with a summary of the key messages and then draw attention to select findings in each of the slides.
Excusez-moi.
Oui.
Excusez-moi, Monsieur le Président. Excusez-moi, Monsieur Gravel. Mais le son est entre...
Sorry, but the sound is breaking and we cannot offer interpretation. So interpretation has been stopped. There is a problem of sound. I think the microphone is too close.
Is it Dr. Gravel, or Mr. Gravel, your microphone? I think you lowered it from when the sound check was done. Maybe try that. So just say a couple words and see if the translation works.
Ron Gravel from Statistics Canada. Does that work?
Translation, does that work? Maybe say a few more words.
Hi there, my name is...
maybe.
Since there are many graphs with details, I will start with a summary of key messages and then draw your attention to select findings on the other slides.
Thank you. Monsieur Thériault, ça marche? Yes? No?
Oui, c'est mieux.
Yes, it is better. Thank you.
Go ahead, please.
Okay, thank you. So a first message is that the pandemic has negatively impacted the mental health of most Canadians. Also, when we look at the life satisfaction as an overall measure of positive mental health, we see that it has declined to the lowest since 2003. Where almost 3/4 rated their life satisfaction as high, only 43% indicated such a level during the pandemic. Finally, fewer Canadians are reporting being in very good or excellent mental health, with young Canadians showing the largest declines. On slide 3, the top graph illustrates that youth experienced the largest declines in life satisfaction since the start of the pandemic. Focusing on the bottom graph, there are some suggestions of emerging inequalities for immigrants, whereas levels of satisfaction were generally similar among immigrants and Canadians born before the pandemic. It was lower for immigrants in June 2020. Slide 4, we now turn to self-rated mental health, which is a powerful indicator of overall mental health status. As previously noted, a consistent finding across studies is that the impact on mental health has affected more youth. On slide 5, this graph shows that the proportion of Canadians who reported an increase in their cannabis, alcohol, or tobacco use during the pandemic compared to before the pandemic began. This is an interesting fact because it shows that compared to other age groups, youth report increasing their use of cannabis the most. That is about 12% of them reported increasing their cannabis use during the pandemic. As well, the greatest increase in substance use was reported among those aged 35 to 54 as an increase in alcohol use. For slide 6, since the pandemic, we see from crowdsourcing results that gender diverse individuals were substantially more likely than female or male participants to report fair or poor mental health. Gender diverse Canadians also were twice as likely as females and 3 times as likely as males to report some symptoms consistent with moderate and severe anxiety. On slide 7, generally speaking, past studies suggest that immigrants arrive in Canada with better self-perceived mental health than Canadians. But this perception declines after a period of time in Canada. So the results from a crowdsourced survey suggest that the opposite pattern during the pandemic. That is, 28% of recent immigrants who participated in the crowdsourced survey reported fair or poor self-rated mental health, compared to 20% of established immigrant participants and 20% of Canadian-born participants. Recent immigrants participants were also more likely to report symptoms of anxiety. Is one where it shows what was presented in the previous slide, and it reports essentially facts in the there.
Pardon me,
so
Mr.
overall,
Gravel.
yes.
Pardon me. Yeah, your sound is
Yes.
breaking up. I wonder if you maybe just turn off your video. We'll get a little bit more bandwidth for the audio. We have your charts here. Thank you.
Is that good? Okay.
Let's give it a shot. Thank you.
Overall, immigrants reported more concern about their health and social consequences of the pandemic compared to Canadian-born individuals. These concerns are about issues such as their own health, household members' health, risk of civil disorder, violence in the home, family stress from confinement, and maintaining social ties. Now, slide 9, turning to the health of Canadians designated as visible minorities, we see signs of poorer mental health compared to those identifying as white Canadians. Almost 28% of those designated as visible minority reported fair or poor self-rated mental health compared to 23%. Reporting moderate or severe symptoms of anxiety was also higher for visible minority Canadians than those identifying as white Canadians. Slide 10. Crowdsourced data also indicate more impacts of the pandemic on First Nation people, Métis, and Inuit. The slide reflects mental health disparities between Indigenous and non-Indigenous people, with higher percentages of Indigenous participants reporting worsening of mental health, high stress, and symptoms of anxiety, When asked how their mental health has changed since physical distancing began, 60% of Indigenous participants indicated that it has become somewhat worse or much worse. A higher percentage of Indigenous women also reported worsening of their mental health. Slide 11 is again just showing some of the factors that influence the mental health disparities observed on the previous slide between Indigenous and non-Indigenous Canadians. I'll skip now to the slide 12. Moving to that slide, the final group that we will profile today are Canadians living with long-term conditions and disabilities. Using crowdsourced data, we see that over half the participants with the long-term conditions or a disability reported worse mental health compared to before the start of the pandemic. More than half reported that their mental health was fair or poor during the June-July collection. Now, on the last slide, slide 13, moving to conclude, the data presents a relatively consistent picture that the mental health impact of the pandemic is negative on Canadians as a whole and a greater impact across a range of already vulnerable groups in Canada. Statistics Canada is committed to working with partners to increase the information available on the impact of the pandemic on mental health. To showcase here some of the how we're moving forward, I've listed a few examples of initiatives. The 2 independent waves of the survey of COVID-19 and mental health, the survey of mental health and stressful events, as well as our active participation in Health Canada Experts Roundtable and mental health data needs and related challenges. Merci beaucoup.
Thank you.
Thank you very much.
We'll start our questioning now. We will start with Mr. Barlow, I guess. Mr. Barlow, please go ahead, 6 minutes.
Thank you very much, Mr. Chair. And Mr. Trainer, I can attest that people are finding the outdoors is the best relief for COVID, as my riding is in the foothills of Southwest Alberta, where all the hikers from across Western Canada spent their summer, which is great to see, but I've never seen numbers quite like that before. But Mr. Gustafson, I really appreciate your presentation today. Very passionate, obviously, as a business owner, and what you've endured. I'm just like your opinion, and you talked about that lack of information. And this week we've had the United Kingdom now announced that they've got a COVID vaccine, and will start distributing that to its citizens. The United States has mass access to rapid testing and home-based testing. They are now reducing their quarantine times. Australia has now announced its COVID vaccine distribution strategy, but here in Canada, we don't have any of those answers. What kind of stress is that putting you on business owners not knowing how long this will go on, or the ability for you to make those plans?
Significant stress. My industry was welcomed into a town hall discussion on the phone with the Alberta government, with Dina Hinshaw, Chief Medical Officer for Alberta. And she was very clear in her presentation to us on that town hall meeting that we will continue to see restrictions on our businesses, and we will continue to see the threat of lockdowns until we have mass vaccinations. That's just a reality that we're going to have to deal with, is what she said. She said that will continue at least through the winter, possibly through the summer. We should probably be prepared for this into the fall. So another year. And I just don't know that my business can suffer that. I don't know if my members and my staff will be patient for that. And so is that impactful to me? Yes. I need a timeline, and then I can plan for it. And hopefully the timeline is as fast as possible so that I can see a little bit of recovery sometime soon.
Yeah, I can sense your frustration there when we are asking for a vaccine strategy and how that will be distributed, and we keep getting different answers and different timelines. And I think it's frustrating because I don't think elected officials oftentimes understand the ramifications and the implications of these delays. They say, we'll have it. But when we see the stats that came out from the Canadian Mental Health Association yesterday, where 40% of Canadians have said their mental health has declined, and 1 in 10 Canadians are having suicidal thoughts, the implication of these delays is profound. And you had a really good point, Mr. Gustafson, about even if you had a vaccine today and you had mass vaccinations and your business was able to open, you've got 7 years of recovery ahead of you financially. what has been do people understand that financial strain of what, these past 8 or 9 months, the damage that it has done to your business and your mental health anxiety is not going to be done when a vaccine is available. This is ongoing.
It is ongoing. Your question is, do people understand that? I suppose I can't fully speak to what other people are feeling, but I don't get the impression myself that people are understanding that. I get a comment quite frequently that, well, you got a $40,000 loan, and if you pay it back in time, it's, I get $10,000 free and it's interest free until that point and whatever. But people don't recognize that it's already a fairly lean business before COVID-19 struck, and now I have to cash flow that. So at some point along the way, I have to figure out how to find more cash flow in my month on top of the already tight business that I run to come up with that over the next couple of years, which means other debt servicing and other projects are going to be put on hold until after that. And so, yeah, I'm looking at right now, our borrowing and whatnot is looking at about a 7-year payback. That's if we go back to our pre-COVID numbers today. And I just don't believe that we're going to do that because I don't believe the confidence in the public is there right now.
Mr. Gustafson, when the Prime Minister comes out and says we need to lock down so we can come back our economy can come back stronger, does that make sense to you as a business owner that a lockdown and more lockdowns, especially through Christmas, makes sense that the economy would come back stronger? Would businesses be there after another lockdown?
No. It might make sense to me if the numbers of where the transmission of COVID-19 is happening supported it. Our premier has said that 0.7% of COVID transmissions are traced back to restaurants and group fitness programs. But on November 13th, he put further restrictions on restaurants and group fitness programs. So I immediately said, this is not going to solve the problem. This is a solution that's targeted. A targeted measure is the word he keeps using. It's targeted at 0.7% of the transmissions. So I said the numbers are going to continue to go up, and they did. So they put more restrictions on us. The targeted measures needed to be put on social gatherings. I think that's where the numbers are. They've done that now, but I think too little, too late.
To the representatives from StatsCan, I'm not sure which one would answer the question, Mr. Latimer, or in your studies, in your results, I didn't see in the documents, has there been any polling on the mental health impacts on small business owners in the work that StatsCan is doing?
Thank you very much for the question. Actually, unfortunately, I am not aware of any of that. I think it is a gap in our information at this point in time.
Thank you very much, Mr. Chair. I appreciate the opportunity.
Thank you, Mr. Barlow. We go now to Ms. Sadu. Ms. Sadu, please go ahead. 6 minutes.
Thank you, Mr. Chair. Thank you all the witnesses for being here with us. It is a very important issue we are talking about. First, I would like to acknowledge that our government takes Canadian mental health very seriously. That is why our most recent health accords specifically allocated over $5 billion fund of additional fund to provinces and territories for mental health. But however, today is the context of is a pandemic. My first question is to Dr. Trainer. Doctor, as we know, seniors are even more at risk of social isolation than before the pandemic. My region of Peel is under the lockdown, and there are regulations preventing visitors from seeing parents, grandparents in long-term care, combined with the fact that some seniors are not tech savvy, loneliness, and less access to technology, because it is a serious issue for staying in touch. Can you let us know the impact of social isolation on seniors, which, if any of the impacts are unique to the population? What actions could be taken by the federal government to assist seniors with the mental health conditions?
Well, that's a big territory to think about, but I certainly agree with you that seniors, and especially seniors in care homes, have been unusually hard hit by this, both in terms of isolation and the physical risk and high rates of death. I don't have specific data on that from our polls, but I think that from my own experience and people actually even in my own family, there's been a major effort to build the social connections through digital means. Even in cases where seniors themselves are not so savvy, it's proven possible to connect people through social media and other things that seem to have a good effect. It's very difficult to kind of weight the difference between increasing social isolation, which of course has its own health outcomes and negative health outcomes, and limiting it due to your attempt to stop the spread of COVID. That's a difficult balancing act. But I think that the main thing from our work overall would be that seniors need to know that there is a way forward from this. The rolling out of the vaccine was mentioned, and I think that's interesting because we are looking in our next survey, which is going to be is rolling out now. What is the impact of this news? What is the impact of the good news that something is coming? And we think it will be dramatic, but we really don't know. But I think seniors will be amongst the chief recipients of that. And also, of course, in most discussions, they will be early recipients of the vaccine because of their high risk levels. And I think that will make a big impact.
Thank you. Dr. Train, a few weeks ago, it was revealed over 600,000 Canadians from across the country used a new federal virtual mental care portal, Wellness Together. This free portal has been developed with experts and has a variety of resources available to Canadians. In your view, are virtual platform like this one an effective means of providing support to individuals in need of mental health support? And what are the barriers that you're aware of the Canadians to use these platforms?
Was that to me?
Yes.
Okay, sorry. Well, I couldn't agree more that that's a very important platform. And it's interesting that I think Canadians who are using that platform are looking for two things. They're looking for help themselves and support in various ways, but they're also asking the question and wanting advice on how do they effectively help others. And frankly, for your own mental health, helping others is a very good strategy. What we found in looking at that, and we've been in close contact and working with Wellness Together Canada, is that one of the barriers, you were asking about barriers, is people's concern about privacy and how their digital information will be used. And I think that Wellness Together Canada has taken steps to allow people to come in and get information and stuff without having to identify or take too many steps that share their own information. But that's the biggest barrier we've seen, is a general distrust of a digital platform. I guess because of all the things we hear in the news about hacking and that sort of thing. But it's an effective tool, and I think a useful one in this context.
Thank you. And one more question for you. You spoke about the study from your organization suggesting that the best activity to support positive mental health is being outside with the winter approaching. This will be less of an option together with the time seasonal depression typically begins. Can you offer any suggestions for how Canadians can cope with the COVID-related mental health issues as we head into the winter months?
Well, it's interesting because I can give you one example from where I live in Toronto, and that was a major announcement by the municipal government that they are going to be opening more trails. They're going to be keeping rinks open. They're going to be taking a whole series of steps so that going outside safely and maintaining distance are going to be much easier. And when we found that was emerging as the number one thing that Canadians are reporting is helpful, we moved to share those results with parks and recreation departments, municipal governments, provincial parks associations, so that they can take active steps so that the barriers to actually just getting out there and enjoying our winter are reduced. So I think that'll be very important. And Canadians are pretty good at handling winter. So
thank you, Mr. Liu. Monsieur Thériault, c'est à vous maintenant. 6 minutes, s'il vous plaît.
Mr. Thériault, it's up to you now. Thank you very much, Chair. Mental health and mental illness have always been a problem for the health system, and we mustn't make the error of not learning the lessons of this pandemic, especially when we're once we've finished vaccinating people, we will have to know that it's not the end of the pandemic. We know that we'll have to invest even more in prevention and in promotion of mental health. And so this is the opportunity to decide where we should and must invest in order to save money over the long term. That was just a general comment. And I would like to have, Mr. Trainer, your opinion. The experts that came to see us and talked about increased challenges for mental health for health services staff and personnel. We know that 82% of health workers in Canada are women, and the first wave of COVID showed that the situation for health sector workers has greatly deteriorated because of increased hours of work and the stress linked to the pandemic. And what is your opinion? What do you think? What kinds of support could be provided to healthcare workers? Do you think they're getting enough support? And how can we make this assistance more effective and help reduce their levels of stress and to ensure they're less affected by the pandemic?
I think that you're right, that our polls have showed that healthcare workers are extremely strongly impacted by this and experience one of the highest levels of increase of mental distress. I think that at the beginning of the pandemic, there was a great deal of anxiety generated by the fact that we weren't really ready, and there was shortages of various kinds of protective equipment, and I think they felt they were being put into very dangerous situations. Now that the situation has become more stable and the supplies and that sort of situation are better, I think people are doing better. What we found is that people, in fact, are afraid of becoming ill themselves, but they're more afraid that illness will strike their families. And you hear many stories of healthcare workers who come home and before they come into the house are changing their clothes and putting everything in the wash and that sort of thing. Generally speaking, in situations like that, what people need is a work environment that recognizes what they're going through, that provides supports and opportunities for counseling and for people to be able to come forward and talk about what's happening to them without fear of reprisals in the workplace. So they need a mentally healthy workplace. And I think they also need what is now coming, which is messages of hope and messages of support that are going to affect their own lives. Most healthcare workers are very anxious about people who don't maintain social distance and act in ways that are making the illness more common. And we see across the country now that the pressure on the healthcare system and the rates in emergency rooms of serious illness are rising very quickly, and in some cases reaching the breaking point. So I think, like everybody, healthcare workers need that message of hope, but they need a supportive workplace and the kind of recognition I think they often get publicly that they are really appreciated as some of the heroes in this whole enterprise.
Merci.
Thank you. After your second study, with regard to the first of your studies, healthcare in crisis, you say that the number of Canadians who said they felt high levels of depression remained stable in spite of the easing of restrictions over the summer. Why didn't levels of anxiety drop during the summer with the lifting of restrictions? Why is that? Do you think? How do you envisage the after-pandemic period? do you think it'll be difficult to come back quickly to to normal levels of anxiety? How much time will it take to get back to that level?
Is that for me? I'm sorry, I'm having a little trouble with my sound.
Oui, je citais votre...
Yes, I was referring to your study, the second survey in your study.
Surprised. We were surprised that levels of anxiety and depression did not change since the beginning of the pandemic. They did not improve in the summer. They have not changed in areas of the country that have, say, higher case counts or more lockdown measures. The levels went up and they've stayed stable. So that's a surprise to us. I can't really explain that. And as to what happens to pull us out of this, I'm not sure.
Merci, Monsieur Thériault. We go now to Mr. Davies. Mr. Davies, please go ahead, 6 minutes.
Thank you all to all the witnesses for your excellent testimony. Dr. Waddell, you authored a report titled COVID-19 and the Impact on Children's Mental Health. And it found, among many things, it found that for children who had been isolated or quarantined, 30% exceeded the clinical threshold for post-traumatic stress symptoms. I find that to be an astonishing figure. And I'm just wondering, considering that that's an acute reaction to the situation, do you have any recommendations for steps that we can take to provide an immediate response that might help those children suffering from post-traumatic stress?
Yeah, really appreciate that comment. There are very effective treatments for post-traumatic stress disorder in children. Principally, they comprise cognitive behavioral therapy. These are therapies that can be done online or by telephone, by video, so the current restrictions are not an impediment. The real impediment is what I mentioned in my remarks, that we had such severe service shortfalls pre-COVID, and so now we're caught quite flat-footed. We need to ramp up the responses very. What those studies in our report also showed, speaking of the word hope, most children do get through this. If their parents are coping better, if their families and communities are better, and highly relevant to all the conversation you've just been having about how adults are doing, obviously very central to how kids are doing, but we need to really significantly increase those services. The treatment that I just mentioned, cognitive behavioral therapy, it's a brief treatment. You can give that effectively to even very young children in just, say, 12 sessions and get kids in a much better place very, very quickly. We just didn't have the pre-pandemic capacity. We need to get it now.
Now, we did hear a little bit of testimony that as conditions improve and perhaps as a vaccine is disseminated and the general optimism in society and stress comes down, that may have a positive impact on people's mental well-being. And we know children are also very resilient. Might we expect a natural reduction in the trauma of children as general conditions get better? And I don't mean to be that as an excuse for doing nothing, but I'm just wondering what the impact of just general improvement will be.
The impact of general improvements, so for families that were struggling economically, for them to get further help, as an example, that will definitely help kids. And the studies that we reviewed in our report show that most kids do recover. But I want to just mention your comment about we still have to address those underlying deficits in children's mental health services. It's not something that I think that Canadians appreciate. I think that it's an invisible problem. But what kind of children's health problem would we tolerate having less than 50% treatment rates for full-blown disorders? So I want to just keep mentioning that because it's quite astonishing.
And would I be correct in assuming that one of the challenges of of mental health challenges, particularly in children, is their inability to identify it, recognize it, and ask for help? Is that an additional barrier?
That's one barrier. I think a larger one is just our still continuing failure to fully appreciate that mental disorders, virtually all of them, start in childhood. And when they first start, they may appear more mild. They aren't going to appear the way that they would for a 40-year-old, for example. So they're a little harder to detect, but we don't ask kids. We could do. And then if right now, if we do ask kids and find out there are problems, it can be very difficult for them to get services. Again, thinking of that, fewer than half of kids with disorders can get services. So
Right.
you can ask someone and then you can't get them help.
Well, I'd like to move to that now. I think to the government's, to the Liberal government's credit, a few years ago they allocated, I believe it was $6 billion over 10 years or a period of time, specifically to the provinces to be put into mental health. And I think it doesn't do violence to any party to recognize that Canada is actually below the OECD average in terms of the percentage of our health dollar that is allocated to mental health. So I think that's welcome funds. I'm just wondering, are you seeing that money actually result in additional services yet?
So I want to say that was a terrific initiative, and in our policy brief to the standing committee, we mentioned that there could be invigorated opportunities to build on that earlier precedent. We didn't see those dollars going towards children. I think it was actually a really helpful move by the federal government to put strings attached for mental health, but the majority didn't go near children. So what I'm suggesting and what our brief, the data we presented in our brief to you suggest further earmarking for children's mental health. Otherwise, kids may never see the benefit, but it's a great form of initiative to do that earmarking so that we increase mental health spending.
Thank you. And if I can squeeze in a final question, we talked, I think you and others have mentioned your
Mr.
study.
Davies, sorry, your time's up.
Oh, thank you.
Sorry. So that brings our round of questions to a close. I'd like to thank all the witnesses for helping us in our study today and for sharing with us your time and your expertise. And we have a little bit of committee business now, so you may feel free to withdraw if you wish. You don't need to stick around for this. For the committee, the clerk has sent out to all committee members a couple of PDFs for budgets for these particular studies upon which we are now engaged. These budgets, I understand, are primarily for to pay for headsets and so forth for witnesses. And such monies as are not spent will be returned basically to the Parliament. So I would like to draw your attention to, let's say the first one would be the amount for, I believe it's a PMPRB study in the amount of $3,000. May I ask the committee to, if they approve this budget, or if there's any questions or concerns? I'm going to ask for unanimous consent for this first budget. Is there any dissent? No dissent? Seeing no dissent, the budget for the PMPRB as presented is approved. The second one is for the COVID study upon which we're also now engaged. That's an amount of $8,500. Do we have any concern or discussion on this? I'll ask if anyone dissents from approval. We'll look for a unanimous consent. Is there any dissent? Seeing none, I declare that budget is also approved. And so thank you everybody for your time today as well, and for your great questions. I'd also like to thank the interpreters specifically. I know it's a challenging environment upon which you work, and I really do appreciate how you're slog through the troubles and travails of this all, and thank you all. So
Mr.
with that,
Chair,
yes?
I have my hand raised. I just had a quick question on the PMPRB study. If I could ask the clerk, part of the motion that was passed requested that each potential witness fill out a basic conflict of interest screen document and also declare whether they're in receipt of any money from the pharmaceutical industry. I'm wondering if the clerk can advise the committee on where we're at with that. I haven't seen any standard document or report. So I'm just wondering if that's what the status of that part of the motion is.
Mr. Clerk, if you would.
So we have 4 witnesses confirmed for Friday of next week, and 2 of them have signed the document. It was prepared by the law clerk. So yes, I could, as soon as I would have the 4 witnesses ready to sign the document, I will send out to all the committee members their signatures, the document signed by the witnesses.
Thank you. And as a follow-up, does that document also indicate whether they're in receipt of money? Because there's really 2 aspects of the motion, the potential conflicts of interest and the receipt of money from the pharmaceutical industry. Are both of those covered?
I think so. I'll have to read that again, but I think so because I sent out the motion to the law clerk, so he based his document based on the motion that we adopted. So, yes.
Thank you, Mr. Davies. And thank you again, all of you. And with that, we are now adjourned.
No, Chair. I just had one quick question.
Sorry,
about
I apologize.
Monday.
We are not now adjourned. Mrs. Rempel-Garner, please
Just
go ahead.
a simple scheduling question. I know there was some questions potentially offline about when Mr. Weber's private members bill would be referred to committee. I noticed that the notice of motion notice of meeting that's been put out for Monday, I'm not sure includes that. So I'm just wondering if you have any clarification on what Monday's agenda is going to be.
At this point in time, I can't give you any more advice on that. I do understand that there may be a couple of, or an amendment coming forward. I think that's going to be discussed with Mr. Weber. And if there's no objection by Mr. Weber and the other parties about that amendment, we may well be able to do this on a expedited basis. Otherwise, we may have to delay until after the break. So, but I'm certainly hopeful that we can do this for Mr. Weber. I've worked with Len for a long time, and I really do support his work and his frustration and dismay that something that was passed unanimously, 2 years ago, 3 years ago, whatever it was, died in the Senate. So I thank you all for your support in that, and I will advise as soon as I can, the clerk, if we're able to do this at the end of the day on Monday, we'll certainly advise you ASAP. So again, thank you all. Is there any more questions that I've missed? Okay, now we're adjourned. Thank you.